this study is focused on patients with squamous cell carcinoma of the esophagus, which is a significant problem in Asian countries, in African countries, in many countries of South America. Although the incidence of squamous carcinoma is going down in Western Europe and North America, um, since there are so many patients in Asian countries, particularly, we need to develop better drugs. The current treatment options are very unacceptable and provide minimum or no advantage. Chemotherapy has a lot of toxicity. So that was the focus of this particular study. Okay, so this was one of the largest, and I think this was the largest study in second line space. So patients with metastatic squamous cell carcinoma were the subject of this particular study. So they had to have a prior therapy, which was platinum based. So all eligible patients had to have that, and um, they were randomized to Tislelizumab, a novel PD-1 inhibitor, or they were they received chemotherapy, which is the standard of care. But in this particular study, the investigator had the choice to give whatever chemotherapy they wanted, either paclitaxel, docetaxel, irinotecan was allowed. And total of 512 patients were randomized 1-to-1. So patients either received tislelizumab or they received chemotherapy. There was no other variation. And the study was conducted not only in Asia, but also in North America. And patients were stratified based on the region, based on performance status, or whatever chemotherapy the investigator chose to give. So they were stratified according to taxane or non-taxane therapy. The primary endpoint is very important because it is overall survival advantage. So there was an assumption that tislelizumab in all patients, all comers, irrespective of biomarkers, will produce an overall survival advantage. The secondary endpoint was to look at patients where the tumor um, is called the visual CPS is 10 or higher. So then another endpoint was to really focus on highly enriched population. So that was the design of this study. So the key findings are very positive, and it showed overall survival advantage for all comers. Now, irrespective of the tumor characteristics based on the immune profile of the tumor. So in all patients, tislelizumab produced significant survival advantage with hazard ratio of 0.7 and p-value of 0.001. And the 12-month survival rate was 37% for tislelizumab, but only 23% for chemotherapy. So that was the primary finding. But I think even more striking finding was in a group of patients who had very high PD-L1 expression. And this is again by visual CPS score. This is a unique method of looking at PD-L1 expression. And here the hazard ratio was even stronger. It was 0.55 with a very strong p-value. And now the differences at 12 months are very striking. So 43% of patients on tislelizumab were surviving, compared to only 17%. So in my opinion, this is remarkable. So if you have a highly enriched population, tislelizumab is producing the effect that we are looking for. So again, this we are hoping that tislelizumab will be approved as a second line option for this group of population, metastatic squamous cell carcinoma in second line setting. And my hope is that the the drug tislelizumab will be approved in United States, in Europe, and also in Asia, as well as perhaps in South America. So the treating physicians and the patients and their caregivers will have another very striking option available to this group of patients. Right now, in many countries, they just get single agent chemotherapy in this setting and they do very poorly. In many countries, in this particular setting, these patients are not even treated. So just imagine how dramatic improvement we can achieve with a drug like tislelizumab. Tislelizumab does come with some side effects. Um, so I think this is something that all of us must realize. However, the significant side effects, which is like grade 3 or 4 events, which are undesirable, the frequency of that is pretty low. So similar to a lot of PD-1 inhibitors, tislelizumab also is accepted or tolerated by most patients. We're talking about 90% of patients are tolerating it very well, but some patients do have undesirable side effects. So something to remember. But the other thing to contrast is this is a non-chemotherapy regimen. Tislelizumab is an immunotherapy. So we are comparing immunotherapy side effects to chemotherapy side effects, and chemotherapy side effects are highly undesirable. So I think that's another discrimination I would like to make.